when we talk about the opposite leg, what's actually going on? So you're healing from your bad knee. What do you end up doing? Right. Chicago, you're absolutely right. You take more pressure on the good leg. I'm Doc Faisal, orthopedic surgeon with Move Smarter Health. We are sponsored by an educational grant from Kinesi Movement. I love sports. I love talking about injuries. I take care of shoulder and knee injuries, and I operate and treat on them. And please consider this an educational, informative video only. Here we go. All right, hockey fans, we're talking basketball. Why? Because the Oilers are out.
Hockey's dead.
Hockey? No, it's not actually, because the Habs are still in it. It was incredible. I was so convinced that the Habs are just destroying my sense of well-being for so long since 1993, the last time they won the Cup, that I didn't realize how much I started hating on the Habs in a way, because I was so frustrated with them. And then when I sort of was saying that the Lightning would win because they were like I just felt like, okay, they're going to just take the Habs. And then you get Caulfield and all these goals and incredible play by the Habs, and they are in. They beat the Lightning. And you know what's funny? Is I remember finding myself cheering when the Lightning scored. And I'm like, wait, what's happening? It was almost kind of like therapeutic release. And I realized it was because there was a part of me that was just starting to despise my own team that I've loved since I was a kid. But in the end, I loved it because my dad loved it. It was like one of those family traits that you grow up with, but I'm still a Habs fan. And, Caulfield is an incredible player, and they've rebuilt the team incredibly well. But the Oilers are out, so we're talking basketball instead. So what happened? Jayson Tatum. What actually happened? Now, you all know about his injury, right? It's not about the pink shoe. It's about his Achilles tear. He blew out his Achilles, recovered from that, back in the game, and then he has a knee stiffness. We don't know what injury it was. Sounds like it was knee stiffness. Now, how does that all work? And then, I haven't been using Charles in a while. Where is he?
He lost. He ran away.
He moved. Is he in the shot? Charles isn't in the shot?
The knee is...
The knee, oh, that's interesting, because Charles was over there, and now he's over there. He's trying to get back in the game. He's trying to get the attention back. Well, let me bring Charles back for a little while. All right. Charles. So what happened? The Achilles was actually on the opposite side, right? So what does that actually mean? So you have the Achilles, you have it repaired, but your connective tissue that does the repair has to heal. That can form fibrotic or good scar, or bad scar, right? So it could be either thickened fibrotic, just to clarify, or it can be nice, smoothly realigned, organized collagen fibrils, as my histology professor in medical schools used to say. And when those collagen fibrils line up well, then you get a smooth Achilles tendon that heals. Because when you open this up, it's like spaghetti, right? Depending on the tear. And if the peritoneum, which is that little sheath, tiny little sac around the tendon, if that's still mostly intact, you can repair that and then heal it. And did he have it fully open, or did he have it partially open, or did he have it not endoscopic? I mean, you technically could put a scope in there. People do, and then they repair it with this gadget, various types that can do it just through mini incisions. I don't think you get as good a repair doing that qualitatively. I mean, you could argue that, okay, it's fixed, it's put together, they heal up, they go fine. But in the end, I'd rather, for the Achilles, get a nice peritoneum repair. Now, the blood supply can be an issue. Now, where does the Achilles go after this? The Achilles, you got all of this. This is your calf muscle. These are the hamstrings. Now, where do the hamstrings go? Is this still in the shot? This You got your gastrocs, your medial and lateral ends of the gastroc. They go above the knee, right? What else comes down? You have the plantaris coming down. The soleus doesn't go above the knee, but you've got the gastrocs. And what else is coming from here? You've got your hamstrings coming down that attach onto the tibia. Right? So you've got hamstrings coming down below the knee. You've got the gastrocs going above the knee. So you have every reason, thanks Charles, good job, every reason in the world to understand that if you don't fully rehabilitate it and get your length tension relationship and your overall neuromuscular kinematic balance, then you're going to run into problems with knee stiffness, and it could be on the opposite side. Why, you ask? Good question from Durham, North Carolina. Great question. One of these days I'll tell you how I know all these people are in the background, but because it's two-way lens. No, it's not. I'm just guessing. But I know it's you from Duke. So anyway, so when we talk about the opposite leg, what's actually going on? So you're healing from your bad knee. What do you end up doing? Right. Chicago, you're absolutely right. You take more pressure on the good leg to avoid the bad leg. So you get into a habit during the recovery of altered kinematic balance. So you're kind of limping on the one leg. You were in a boot for a little while, so you're sort of stiff-legged, as it were, already on that side, and you compensate with the other leg, and then you have to retrain yourself when you recover to start stretching and getting your kinematic balance off. So what can happen if you overuse or strain one joint? Yes, absolutely. You can get stiffness. Why? Because overstraining causes inflammation. Inflammation can cause scarring. All of that can cause limited motion, and that limited motion you then results in problems. Now, was it stiffness or was it strain? And is that strain leading to further problems? And for an athlete to say that he's 85% or only 85% is pretty astute. That's a good clinical observation. However, what does that mean? How does that translate into play? Do we actually know what his overall neurokinematic balance is when he is playing or practicing? Not really. Do we have that detailed neurophysiological, neurokinematic architecture quantification of his knee joint to the precision of sub-millimeters? No. We don't. We don't actually see inside his knee when he's running, when he's walking, when he's doing all these things. So there's a missing component of understanding neurokinematic balance. I mean, you can go and do jumps and squats and leg training all you want, but until you get back on the field, onto the court, you're not really going to know how the knee does in terms of stability. Now, why would you worry about stability when you have an Achilles tear? It wasn't a ligament. Well, good question. If one part is stiff, other things can loosen to accommodate, okay? Multiple joints give us that flexibility, right? I mean, you could have someone with a hip injury that ends up with an ankle problem. I'm not going to give it out yet, but we're going to talk about that next. So, what actually happened? We don't know exactly. If we had an incredible analytic platform that looked at his entire mobility before the game, during his training, before and after, and even before his injury, we would have an incredible kinematic analysis down to the precision of joint level function. Above the knee, below the knee, his entire body. Sure, great. But we don't have that. So we are limited in what we know. Video analysis only goes so far. There are, vest, motion detectors. They only go so far. You can only measure things so far if you don't get that true precision of joint mechanics. And that's really what we need and what's missing right now. But in this particular case, his knee was sore, his opposite knee was sore, whether it was stiffness, whether it was tightness, whether it was a strain, we don't know any of that. And sometimes an MRI won't necessarily tell you more information. Will the MRI tell you enough about subtle findings? Maybe, sometimes it can, but not always. That sounds like a political pundit sort of response.
Yes and no.
Yes and no. My engineer loves that. Yes and no. So, when we're talking about the knee, it absolutely makes sense that someone is having that type of issue. Can you name any examples of other athletes? Oh, come on. You got it. There you go.
Joel Embiid.
So, Idaho, you were the first to respond. Yes. Klay Thompson, KD, you name them, you got it. Klay Thompson, classic example, hamstring tightness, a little bit of issues with his hamstrings. Then he blows out his ACL, right? I won't recreate that. I've broken too many parts. So he blew out his ACL, then he recovered, and then he had an Achilles tear. So every part in symmetry, in symmetric neurokinematic, precision kinematic balance can all be affected in that entire neurokinematic chain of events, okay? It's a cranial-neuromuscular unit. Your confidence and how you're tuned into your body kinematics translates directly into how you move, and how you move translates directly into how your joints react, function, and balance. And all of that can be disrupted. Minor injuries like a groin strain to big injuries like a back injury, or blowing out your ligaments, which we've seen multiple times. So there's plenty of history about why this is happening. I mean, I've done plenty of segments on ACL tears. I've done segments on various knees out there, whether it was KD, Klay Thompson, now Jayson Tatum. I mean, he's a big loss. But let's see, hopefully he comes back. We don't know more details about his knee injury. It is a knee stiffness as the official record. And when we get more, we'll see. Let's see how he plays. And it would be interesting to really look and see how much force is he actually putting through that joint. What is the joint load happening live when he's moving in either side? That would be a remarkable achievement to be able to detect that live in real world when someone's playing. And we don't have that yet, right? So it's coming.